Thank you, Mr Speaker. My question is to the Minister for Health. Minister, we understand Tasmania's borders cannot stay closed forever. When we reopen, COVID will come. The influx of people from COVID states starts on December the 15th, and we must have our health system able to cope with the inevitable caseload. Minister, we're being contacted daily by Tasmanians who are extremely anxious about reopening. Healthcare workers have expressed concerns about staffing plans. While we have a fully COVID vaccinated health workforce, vaccination does not always protect a person. Your department's dashboard data are evidence of a health system that already doesn't function to modern standards. Minister, with understaffing a chronic issue, how will you manage when some of the workforce may not be able to fulfil their duties? Have you modelled the number of healthcare workers who may contract coronavirus under various outbreak scenarios? If you have, what do the models say and what plans are in place to deal with them? If you haven't, why haven't you?
Honourable Minister for Health.
They're actually the questions the community wants
Order.
us to ask.
Order.
We've got a 45-minute briefing yesterday. It's not time to answer a lot of questions.
Minister has the call. Everybody else should be silent. Minister.
Well, thank you, Mr Speaker, and I thank the honourable member for her question. And yes, there is some natural anxiety around the opening of borders across the community, and I will understand that as Minister for Health, as does, of course, the Premier as well. And we have been planning and preparing for many months for the opening up of our borders, of course, and it includes vaccination. And I must say once again, vaccination is the number one line of defence when it comes to COVID-19 preparedness. Mr Speaker, there are a number of questions with respect to the honourable member raised. Can I inform the House that of Monday the 8th of November there are now 127 employees who remain non-compliant in terms of the mandatory vaccination. This equates to 66 permanent employees, 11 fixed term and 50 casual who have failed to comply, representing less than 1% of the workforce. Understandably, Tasmanians very keen to understand that our health system, which I've said on numerous occasions, is experiencing increasing levels of demand in terms of emergency department presentations and the like. There are a number of areas that we're working on in terms of resourcing our hospitals, recruiting more nurses and, of course, paramedics as well more broadly.
Have you done some modelling?
When it comes to the Reconnecting Tasmania plan, it will allow our borders to reopen safely to travellers while ensuring we have the health and safety nets in place to keep on top of COVID during the reopening phases. And of course, we have undertaken modelling by Professor McIntyre from the Kirby Institute, and based on our strong vaccination rates, we are confident that our state can reopen on December the 15th and that our health system is as prepared as it can be. Now, as I've said, a significant amount of work has occurred over the past 12 months to ensure that our hospitals are ready, including increasing our public bed capacity. There'll be 152 new beds by the end of this year, from May 2021 to December 2021, Mr Speaker, hiring an additional 840 FTE since July last year, with further recruitment for new beds underway. Our escalation plans also provided their highest level for a surge capacity of up to 211 COVID ward beds across the state and up to 114 ICU surge beds. In addition, we have now 2 community care facilities, Fountainside here in the south with 50 beds, and the Coach House in Launceston with 25 beds.
You're not talking about staffing. Have we done the modelling?
Order. Member for Franklin, order.
On equipment, we will have 367 ventilators available in the state, and we already have a secure 6-month pandemic stockpile of the critical PPE that will be required. And of course, finally, as well, the Department of Health is currently finalising our COVID at home model of care involving home pulse and oxygen monitoring and 24/7 support to assist to keep COVID care in the community and safe hospital beds for those, of course, that truly need it. repeated. Now, can I say again, vaccination, Mr.
Well,
Speaker,
point of order,
is the number
Mr.
one.
Speaker. Relevance 45. The Minister hasn't got anywhere near this question. This is a media
It's
release.
not a point of order. What's your
The
point of
fact
order?
is, it only provides 73%
Order.
infection.
No, that's not a point of order. Please sit down.
And
Please sit
staff
down.
aren't
You've
fully
asked the
protected.
question. Please sit down.
Well, he needs to come some way close to answering
Order.
the question.
Come on.
Have you done
There's
the
been an
modelling?
enormous amount of work
Member for
done
Franklin.
in terms of this preparation. Dr Woodruff, and you well know that. I'm going to repeat, vaccination is the number one priority, and I've mentioned a number of
not
times
enough.
in the recent
Member for
outbreak.
Franklin, if you interject again, you'll be asked to leave.
The recent outbreak in New South Wales, and I've mentioned it a number of times, but it is a point that needs reinforcing, Mr. Speaker, because in that outbreak, 95% of the 8,851 people hospitalised with COVID-19 were not fully vaccinated. Every vaccination will count towards a safer border opening and will help reduce the load in our hospitals and
Point
the
of order,
public health
Mr.
measures.
Speaker. I would like, on behalf of the people who are contacting us and healthcare workers, for the Minister to address the issue of whether or not there's been modelling about the impact on healthcare workers.
Again, that's a separate question. But
what are you doing
the
about it?
question has been put to the Minister. He's answering it. The
Thank
Minister has
you,
the call.
Mr. Speaker. Now, as I've said before, I understand there is anxiety about what will happen when Tasmania opens its borders, and that's only natural, as I've said, particularly among those who are more vulnerable in our community, such as our elderly, Mr. Speaker. We have prepared our health system as much as it is possible to do so with additional staff, more beds, ventilators, surge capacity, COVID beds and ICU beds. It is important to note that it has been shown nationally and internationally that the majority of people who are COVID positive will experience a mild illness and not require hospitalisation. They will be able to be treated effectively in their home, and I've outlined the purchase of
Minister,
2,500 smart devices which can be dispatched statewide, and patients will enable daily monitoring of pulse rate and oxygen levels as well. Can I say that our recruitment continues when it comes to our focus on recruiting across the health system more broadly. Our recruitment efforts have been positive between the 1st of July 2020 and the 30th of June 2021. Going to the Honourable Member's question around staffing, we saw an increase of 655 paid FTE across the
If you could
department.
wind up, Minister,
and I'm
please.
advised that increased FTE overall by 185 this financial year, taking the total, as I've said, to 850 full-time equivalents, Mr. Speaker. We are as prepared as we could possibly be. Dr Woodruff, I understand the question, I understand the concern in the community, but there's been an enormous amount of work in terms of preparing our hospitals, preparing for care at home, recruiting as well in terms of our COVID-19 preparedness.
Mr.